Did you know it's recommended by dental offices nationwide to brush your teeth for 2 to 3 minutes? Now, the average American brushes their teeth roughly 50 to 70 seconds. So you're probably thinking, okay, what does this have to do with me? What's the worst that's going to happen if I brush my teeth for 1 minute every day? We're going to dive into that later. I've been a part of the dental community for about 2 years. I've seen people come in with beautiful, perfect teeth, no fills, no decay, as a full-grown adult. I've also seen someone come in more recently, the past probably like couple months, with teeth like these. This was a 17-year-old boy. This is something that can be completely avoided. This is something that started as something small, and throughout many years, he just dealt with the pain and ignored it and pushed through, rather than coming in and dealing with what was going on. At age 6, we start to develop our permanent teeth, and these teeth are built to last us our entire lives. More than likely, at some point, each one of us are going to experience some form of pain in your mouth, okay? Having a knowledge and applying that knowledge can help limit dental visits, along with limiting pain in your mouth. My goal today is to not only inform you on the importance of good oral hygiene, but also to help you maintain good oral hygiene. So to start off, we're going to go into detail on what can happen if you slack off on brushing or flossing, or if you forget it altogether, and then we'll go into maintaining a good, healthy mouth. So first, we're going to go over the importance of good hygiene. Oral health is something that's going to affect your daily life. So if you have pain in your mouth, it's going to make it harder for you to concentrate on whatever you're doing. Working, school, possibilities are endless, right? So this being said, you're going to get to a point where you just can't stand it and you're going to have to come to the dentist. So you come to the dentist to figure out what's going on. Great, we figure it out. Okay, now we're going to have to see you again to treat that problem. Most of the time, your dentist doesn't have time that day to treat the problem. So now we're looking at 2 dental visits to fix what's going on. Rather, you could have just been brushing and flossing your teeth and avoided this altogether. Not only does it affect your concentration, but oral hygiene also affects your entire body. The Oral Health Foundation found that at age 70, if you have 20 plus teeth, you're more likely to live longer than somebody who at age 70 has less than 20 teeth. So just so we're all on the same page, everyone starts out with 32 teeth. Next, gingivitis, which is one of the more common things I'm sure some of you have heard of, can lead to periodontitis. This can lead to tooth loss and infection. So these are some pictures of severe cases of periodontitis, and it kind of shows what it does. It's when your gums recede, as you can see here, and then it leads to infection. This infection can lead to bacteria in your mouth, or you can develop bacteria in other ways by not brushing and flossing. This bacteria will lead to traveling from your gums down to your heart, and once it's in your heart, you can get heart disease, you can get or have strokes, and this can lead to your death. So hopefully I haven't scared you off too much, and hopefully rather than scare you, I've helped you see the importance of oral hygiene, and you'll be that much more interested in what I'm gonna have to say next. So how can we maintain good oral hygiene? Well, flossing is vital. It helps avoid the gingivitis and periodontitis as mentioned above, and flossing also covers 40% of your tooth surface. So by skipping this, you're taking care of half of the surface of your tooth. Second, brushing twice daily. Third, avoid snacking and sipping drinks throughout the day. Avoid anything super sugary, and I mean, you can have it here and there, but try to not have too much of it. Fourth, go to your regular hygiene checkups. We're here to help you. If you have a small fill, let's get it treated. Let's get it taken care of before it turns into something big. Just a month ago, we had a patient come in who was complaining of lower jaw pain. He told us what was going on, and we dove a little bit deeper. Come to find out, he had cancer. This wouldn't have been found out if he wouldn't have came in for his regular checks. Lastly, fluoride is a great strength to your teeth. Here in Utah, it's not found in the water, so what we recommend is buying toothpaste with fluoride, and this can be found at Walmart, CVS, wherever you're shopping. So, this all being said, I know I've thrown a lot at you, but what it comes down to is adding an extra minute and a half to your daily schedule, and then just an hour to every 6 months. That is not too much to ask. I haven't always been the best at taking care of my teeth, but since I've implemented these easy steps, I've seen a difference personally. So don't be that person who comes into your office knowing that you haven't been taking care of your teeth. If you think you're above good oral hygiene, or you can skate by on the bare minimum, now you know that flossing and not brushing can lead to problems throughout your entire body. So floss those teeth and brush twice a day. After all, now you know your life depends on it.